of us have been under this lockdown since 24th of March to combat coronavirus. All of us have been holed up inside our houses. We've not been able to go out, meet friends and family. All of us, most of us have been working from home and still continue to work from home. We're not going out to buy anything else apart from the essentials. We're trying to minimize our trips outside. But at this point of time, we realize that this lockdown has taken a kind of a mental toll on our mental health. And there are people who have been battling depression and mental issues even before the lockdown. So for them, it is like the last straw that has broken the camel's back. It's become even worrisome because they cannot go out and meet their families and friends, and there are very limited options available to them. As we've seen that during this lockdown, there have been certain suicides that have come to light, and it's very depressing around. So here in this discussion, we will try to decode the entire issue. We're joined by Doctor Ashish, who's a consultant psychiatrist, and he's an alumni of AIIMS New Delhi. Thanks a lot for joining us, sir. So as we know, during this lockdown, it has been very challenging for all of us. But there are people who've been battling depression for quite some time, and this lockdown came, and it has been continuing for quite many months now. So how do you see this entire lockdown taking a toll on their mental health and worsening the situation for them?
Okay, first of all, thank you, Anubhuti, for taking this initiative. It's a much needed step because we all know lockdown has been there for a couple of months, and situation is very challenging. And coming to like people who have already been diagnosed with depression, and now we see there are numerous challenges. With lockdown, there comes economic slowdown, fear of losing job, fear of getting infections, isolation, quarantine, innumerable challenges are there. Now with this, we know certain things we cannot remove immediately. The pandemic is going on, it is not going to go immediately. What we need to do is to step up certain social factors, psychosocial domains which we can strengthen so that people understand and become more resilient, and whatever resources we have, we need to utilize those resources. So already we know that people who are having depression, there are challenges, like they may be living alone, family may be in a different city, they have fear of losing job, these kind of things. Now hospitals in many places, OPDs are closed because of this reason. So connection to the healthcare sector is also slightly difficult. Travel, moving out, restriction of movement. What we need to understand that whatever resources, whatever things we can utilize, we should use those things. There are helpline numbers available. We should seek online consultation if we have. We need to strengthen our social support system, family members, close friends. We need to modify our lifestyle. We should understand that we are not following some irrational or erratic lifestyle, taking alcohol, tobacco, these kind of things. So non-pharmacological intervention which can be followed, these are useful. We have to be slightly proactive here. And with that, we need to understand whenever there is a need, there is a need, so that we can take help of available mental health resources. Telecommunication or telemedicine format is available. It has been functional also. So whichever city patient is staying, maybe Delhi or outside Delhi, Mumbai, anywhere. So those system we need to utilize. Although it's very challenging, but we need to be slightly become more proactive, and support system we need to strengthen.
So sometimes that happens that when person is facing any kind of mental issue, any kind of depression, not exactly does he understand what is happening to that person. Then he wants to meet somebody. And in this coronavirus, what we are to make sure is social distancing. So don't you think that it becomes very challenging for a person who has been battling depression, battling mental anxiety, any kind of emotional distress for a long time, and suddenly he is not able to meet somebody in person? Do you think that just meeting somebody socially online is enough?
Yeah, see, Anubhuti, we need to understand the context, and we need to understand we are battling a pandemic. It's a massive pandemic, and it's not something very easy to tackle. The entire world is battling this thing. So there are challenges. We have to ensure certain guidelines. We have to ensure certain recommendations to prevent society from getting further infection. We have to restrict the spread of infection. So that part is there. Whatever necessary steps which are suggested by higher authorities or medical authorities or medical organizations, those things have to be followed. Yet, at the same time, mental health issues which can be exacerbated by these steps, we need to understand, but at the same time, we have to build up whatever we have. Suppose we have to, there will be restriction of movement, there will be going out, restriction and going out, enjoying and get together, those kind of activities. But we have to follow, or we have to create some ways to face this challenging situation. So we have to develop some strategies, like sometimes you can have video calls with friends or colleagues, whatever social activities which are pleasurable, which are enjoyable, which gives you social warmth, emotional strength, those activities have to be nurtured. We don't have any other option. We have to develop these kind of strategies. And once, because it's handling pandemic is also challenging, and there are steps, there are ways to tackle pandemic also, but same time for mental health issues, whatever we can do, whatever resources, manpower, whatever mental health healthcare system can offer, those we have to utilize maximally. And there are guidance available online. There are people who are there. There are helplines. There are organizations which are providing necessary services to understand what are the issues, how to cope up with them. If there is a necessity to meet like psychiatrists, then they have to seek that help.
So, sir, what we are to understand is that there are a lot of patients who may have recovered from depression, who may have recovered from any kind of mental issues, but after this pandemic came, they're back into that kind of mental issues. So what are the first signs that one should look for to make sure that, that person can recognize that kind of depression is coming back? So what are those first signs that one must look for?
See, if persons who have recovered from first or second episode depression, and suddenly this is a stressful time, individual situations may vary. Possibility could be they might be staying with family, or they may be living alone. There may be other stressors like fear of losing job, extra workload, maybe their financial, those kind of difficulties. So similarly, like if they are experiencing persistent low mood for most of the time during the day, they are having negative thinking continuously. They, if the friends or colleagues notice there is poor interaction, and they observe that they have the sleep or appetite or those kind of activities are reduced. They are not enjoying the activities they used to enjoy. They perceive they are not able to handle these changes in behavior on their own. This is the time they should seek some external help and see what can be done at that particular moment.
So how do you suggest as a doctor, as a psychiatrist, to adapt ourselves to this pandemic that it stops affecting our mental health so much?
We need to, there are a lot of guidance which has come out in past 1 or 2 months. Because working from home, staying away from the routine which we are living right now, it's not the usual pattern of our life. We are social beings. We like going out, enjoying, and get together. Those kind of activities which are restricted. So we have to adapt to healthy lifestyle, diet. Avoid taking alcohol, tobacco as a form of coping skills or getting rid of anxiety or sleep-related problem. Adhere to a healthy diet pattern. Follow yoga, which is very helpful. Breathing exercises. Connect socially. Build up your friend circle. Whatever colleagues, whatever time you used to enjoy. With that, we have to transform certain activities in online or using tele methods. And apart from that, if after doing these kind of activities, if there is a problem in handling emotions and one feels there is too much of heaviness or irritability, anxiety, fear, overwhelming, then they should definitely meet psychiatrists or clinical psychologists in nearby areas. But there are guidance which is available and which has to be followed. Apart from that, there is a necessity to strengthen the support system so that they adhere to these kind of lifestyle, because it will remain for a long time and it requires certain commitment from our side. So there will be individuals who are vulnerable. For them, the social support system is need to be strengthened, and that is why the family members or the friends or whoever society, if they are living, they have to be slightly proactive to develop those kind of things. There are people I know, like certain organizations, if they have allowed work from home, but at the same time on weekends they are having online get together, like all the workers, they will get together, online parties and some jokes. So these kind of activities, new kind of strategies, problem solving attitudes has to emerge from us, and we have to be patient. We have to be read kind of books which are helpful to in these times, and keep a person or somewhere like a mentor who can guide you in difficult times. Stay in touch, be positive. So those kind of activities are required in a persistent manner.
Yeah. So as you say that people who've been battling depression, who feel very low, they should seek out help. They should visit a psychiatrist. But at this point of time, it is very challenging to go to a hospital. Many of the clinics are not functioning, and most of the doctors are now under COVID duty. So at this point of time, it becomes very challenging and very difficult for the patients to actually reach out to doctors and get help. So what is your take on it?
I understand, because situation is challenging. Hospitals also have restrictions. OPDs are closed at many places. There are challenges going to hospital, like fear of getting infection also. In this situation, the first step would be, if someone is experiencing emotional problems, those initially start with, rather than visiting, if they are minimal or mild and which are unable to, seek online helpline numbers where they can call up and discuss their issues. There are helplines, there are NGOs, there are psychological. I remember a lot of these kind of numbers have been issued where a person can discuss whatever the emotional turmoil or psychosocial problems they are facing. Apart from that, if from there, if they are not able to manage, then telemedicine has been operationalized at many places. So teleconsultations can be obtained. Already people who have been previously visited hospital, who are on medication, they can discuss with the whichever hospital over the phone or these kind of methods whether to continue medications. Follow-up OPDs are functional, and very rarely some at some particular point, and some patients may need. So for that we have to be follow whatever the necessary preventive measures and go ahead with that, because we have to find out a way in each and every problem.
So, sir, as you talk about medication, my question is that, is it necessary for people who are battling depression, who've already been battling depression and now things are getting worse, is it very important to actually get some sort of medication?
See, medication, there are medications. It's not like that. If someone is depressed and immediately start medications, there is a proper assessment. Some may be subsyndromal depression, mild depressive episode, maybe. So it will be on individual basis. So first step, if someone who has not had depression and suddenly experiencing low mood or decreased interaction or negative thinking, so you start with rather than visiting helpline numbers and see if they can offer help and you can get rid of these kind of transient emotions. If there is a definite diagnosis, then whatever necessary pharmacological interventions are there, it will be implemented. So there is no worry. But it's not like that. If you have depression, first thing is to establish the diagnosis of depressive episode. So usual protocols which are there in place, those are to be followed. If there is a need for medication, it will be definitely be given.
Yeah. So, sir, what has been your experience in this pandemic as a psychiatrist? Have you been getting more and more complaints, more and more cases?
Yes. So many calls have come recently, and I've been involved at lot of places regarding this kind of guidance. Many youngsters basically, because there is lot of they do not understand to handle this kind of situation. What is happening? They are more engaged in social media platforms, and there is in numerous negative news flows, those kind of things. So always corona related negative news. They have excessive fear, anxiety, I must say, depressive symptoms also. If they have some minimal physical symptoms, they think they have got corona. So these kind of, so I have advised them limited social media access, build a better lifestyle, or change lifestyles which are suitable, which are helpful. Those things are to be followed. If there is a need for medications, I have guided them. So many calls have also come, like sleep related problems, tobacco and alcohol use also, excessive fear of related to whether they might lose job. That has been very particular in some people. So whatever important decisions they can take, they have to wherever there is a need for guidance, like how to cope up with these things, coping skills management, breathing exercise, anxiety, which can be practiced at home, exercises or skills, those things have been advised.
So sorry, to end this on a positive note, what is your message to all those people who've been battling depression for quite some time, and now under the lockdown it has kind of worsened? Now that we have to maintain social distancing, people can't go out. They can't go out for a walk in the park. Also, people are very panicking over the fact that what if they catch coronavirus? So what is your message to all those people as a psychiatrist?
I would suggest, even though times are very challenging and it will continue to remain, you have to be hopeful, you have to be positive, be patient, fill your mind with necessary information, build up the support system with family, with friends, colleagues, whatever activities one used to enjoy, although not possible right now, but there are alternative methods which needs to be utilized so as to maintain a healthy lifestyle. Whatever necessary guidance related to activities, like avoid taking so much of tobacco or alcohol related, those kind of things. Stay in touch with the mental health team, whichever place or city you are in. Keep seeking right and scientifically valid information. Stay away from negative news. No need to watch news 24/7. You can watch news for maybe 15-20 minutes, get the necessary information, enjoy whatever activities you do. Like many of patients or colleagues or friends, they have started online classes like guitar learning, whatever pleasurable activities like drawing, painting. So enjoy them. Build a new normal. There are a lot of material available, guidance available. You just need to get in touch with those people who will be able to guide you. So that is the most important thing, because this is you have to be slightly proactive from seeking help, and the higher side, they have to be proactive to provide the help. So that connection we have to build, or that connection will come like people like media professional. They have to circulate, they have to build people who need help, and mental health professionals who are at position to guide people who need help. So that kind of collaborative approach will help the massive society or the entire nation. So that will be my message. If there is anything, contact your nearby psychiatrist or hospital. They will definitely help you. And if there is a need, we should be circulating. We should be slightly more proactive to make it more to reach out the public as much as possible with the guidance.
Thank you, sir. Thanks a lot for joining us. I'm sure this discussion must be very helpful for all the listeners, all the people who are watching Oneindia English. And I'm sure that people will stay strong and we'll come out strong out of this pandemic. And everyone should maintain social distancing and not let this pandemic take a toll on our mental health.
Let's hope for the best.